Hey, it's me, Christine, and I am 3 hours post-op from my breast reconstruction revision surgery. And I wanted to do a brief video on how I am managing pain now that I'm in my recovery chair, which is a recliner. So as you can see, I have a little surgical marker left on my neck. I just arrived here at home and I am having a lot of pain right now in general. Even though I have been given support through pain medication, it is not realistic to expect that you would have absolutely no pain. And so I wanted to share with you how I am managing that pain. And secondarily, I also just wanted to talk about mindset. So let's talk about the physical pain first. I would say that my pain right now is nerve pain. I feel it most on my skin where I had my scars revised, and I am experiencing sharp pain, stabbing, burning. It feels a little bit at times like a knife stabbing, and other times kind of like fireworks or electric lightning bolt type sensations. So while it's not a steady sensation, it's pretty rapid fire, and it gets worse and then it gets a little better, but it's pretty bad. I would say it's about an 8 out of 10 on average. So I wanted to talk about how I am working with that pain that I am feeling right now. In general, I'm able to get it down to about a 5 or a 6 if I'm really focusing. So here's what I'm doing. Basically, physical relaxation, because when we feel pain, it is an instinct to brace against it by tensing one's muscles. But if we do that constantly, the pain can kind of escalate, and that can lead to feelings of fear and panic as well. And so we might end up in this vicious cycle of feeling really scared and in a lot of pain, and that's a very out of control feeling. There are things we can do to empower ourselves to manage pain, knowing that it is temporary, that this phase of immediate post-op, that first day, will pass. So what I am doing is I am focusing on areas of my body that are not the painful areas. I'm finding muscle tension in those places, and then I am consciously asking myself to relax it. So I'm going to do that right now because I need to do that right now. So I am going to just close my eyes. I can feel that I'm kind of gripping my face muscles, so I'm going to choose to relax the muscles around my eyes. And as we do a body scan, I could do a scan through my face. And even as I was doing the eyes, I noticed that I was also kind of gripping the muscles of my jaw, the muscles of my cheeks. And so you can kind of work your way through the face, the neck, and the shoulders. You can also notice if you're gripping into your hands and wrists, but pick places that you do not have critical acute pain and scan those places for tension. And then one at a time, try to relax them. So when we do this, we can bring ourselves successively into a more complete, a more general sense of relaxation. And while the pain is still there, we are able to overall reduce the distress that we feel and the level of that pain through this deep state of relaxation, working muscle by muscle, body part by body part. The second thing I am doing is I have a set of earbuds, and once I get myself kind of under control, pain's down to a 5.5, 6, I throw my earbuds in and I listen to music and kind of focus on the music, not the body. Eventually that pain starts to demand my attention again, which it kind of is right now. So I will be doing this the second the video is done. And I'm going to just start it all over again. Scan your body. Is there a place I feel tight? And you'll find those muscles, they lock right back up when the pain starts back up. So that's the main strategy, is to really, like, literally roll up your sleeves and get in there, work with yourself, work with relaxation of all your muscles. And then the last thing I just wanted to talk about is knowing that this will pass and not expecting that there is enough medication in the world to put you in a state of no pain when you're post-op on the first day. So if you have that expectation going in, that you've got a plan, you're going to be working with it, almost like anticipating childbirth, you know there's going to be some pain, you're kind of expecting it, and you know it will pass. Same thing with immediate after breast reconstruction surgery. So you will get through it, I will get through it, and we're just not worrying about things right now like, what does the outcome look like? I am personally choosing not to focus on whether or not the surgery looks good. I will choose to engage with that on another day when my pain levels are either completely low or very low, when I'm ready. So be well. I got to get back to it because just even making this video, I am needing to go now and get right back into my process. So be well, and I hope this has been helpful to you. And yeah, lots of love to all my breast cancer recovery sisters out there.